Nung wala pa yung pandemic, okay pa yung kita namin. Ngayon,
lockdown of the capital Metro Manila
to raise its COVID-19 alert to the highest level,
during which the movement of everyone will be significantly limited.
On January 30, Philippines recorded its first COVID-19 case in Manila. Unbeknownst to many, the virus would manifest a month later with over 100 cases spread across major cities. On March 16, President Rodrigo Duterte locked down major cities in our nation. Non-essential industries closed or implemented work-from-home programs. Public transportation was suspended. Community events postponed. Many Filipinos could take necessary precautions. The urban poor could not. Venus de la Cruz is one of them. She is from Masantol, Pampanga, and a mother of 4 little children.
Nakiki-extra lang akong labandera, nagpaparipa, at saka yung nagpapa-order ng mahuhulam ng mga taho.
Needy families were forced to stay home, even if it meant being cramped together in spaces no larger than a standard bathroom. And it's very difficult also to Jesus David from Moras de la Paz, Santo Tomas, Pampanga, a mother of 11 children.
STL po yung kasi yun ang hanap buhay namin, tapos nakikipaglaba. Minsan pagka buenas, hindi pa tama, hindi naman binibigay. Nakakatulong din. Matagal na ako, 3 years na ako.
Yan po yung halap buhay ninyo.
Matagal na. Mga bata pala yung ko. Doon nakakapag-aral sila.
Around 20 million Filipinos live in slums, where they have to survive poor housing conditions, lack of sewage facilities, and little to no access to clean water. Local government units struggled to take care of thousands of families. Under the Enhanced Community Quarantine, or ECQ, each household had one quarantine pass, enabling one family member to go out for essential goods and services. Residents found outside without a valid reason could be fined, jailed, or made to do community services. But for some urban poor, they'd rather get fined, arrested, or shamed online than stay hungry or cooped up in homes that become furnaces during humid summers, where temperatures can hit 41 degrees Celsius. During the lockdown, surgical masks and sanitizers were severely in lack even in hospitals and healthcare centers. And for people like Venus and Jesusa, these vital items were too expensive. This lack of protection worries experts, as they fear many cases are going undetected. The Philippines has one of the highest COVID-19 mortality rates in Southeast Asia. Early detection could help curb the outbreak and prevent more deaths. So, the government has set a goal to test 1% of the population, slightly more than 1 million people. But many are still not assured. PhilHealth, the national health insurer, previously bore the full cost of COVID-19 treatment. Then in mid-April 2020, they announced that only subsidies will be given. That's not the only sign that Philippines' healthcare system is straining under the weight of the pandemic. And according to the World Health Organization, in the Western Pacific region, the Philippines has one of the highest number of medical staff infected by COVID-19. The message of the experts to Filipinos is clear. Stay at home to stay out of hospital. As simple as it sounds, it remains a feat for a Filipino like Venus and Jesusa. Living hand-to-mouth meant the daily hassle was their only means for survival.
Okay naman. Kaya lang, medyo mahirap. Sometimes nangigit ang pandemya.
Hindi okay kasi iniwan ako ng asawa ko, 4 na bata ang iniwan sa akin.
The pandemic has made their difficult lives even harder, but they did not lose hope.
Niya. Siya nangyayang sa buhay niya. Yung problema, sandali lang sa yan.
Mapayapa at nakaraos. Hindi kami nakabayad.